Alberta Health Services puts together an objective list of infrastructure priorities that it submits to the government. And every year, ministers of health have ignored most of these high-priority requests. Now, it seems that this Minister of Health, under a Premier who promised to do things differently, is making health care decisions in the exact same way. Cardston, Strathmore, Wainwright, Red Deer, Fort McMurray, those are all the places that AHS says is a priority. Minister, why are they being ignored by your government, if not for purely political reasons?
The Honourable Minister of Health.
Mr. Speaker, this government is investing throughout the province. We're investing money in the South Health Campus, in the K. Edmonton Clinic, in Fort McMurray, in Lethbridge, in Medicine Hat. Everywhere we're investing money to improve health care for our residents and throughout Alberta. That's a passion for this Premier and for this Minister.
First, supplemental.
Now, Mr. Speaker, we're obviously getting close to campaign time, and I say this because the sure sign of election is the pre-campaign promises to the people of Whitecourt again for a new hospital. It happens every 4 years, going back as far as 1993. That promise was repeated again by the Minister of Health just a few weeks ago. Now, what I find curious, Minister, is why you would make that commitment when, according to your AHS, Whitecourt is not a priority. So can you please explain to me the disconnect?
Mr. Speaker, priorities are set by Alberta Health Services, by Alberta Health, but also the residents of this province and the needs that they have. And Whitecourt has been in need of a hospital for a long time, and we'll work with that community to build one. Thank you.
Final supplemental.
No, Minister. No, Minister, and I'll share the fight with you that clearly lists the priorities.
Exactly.
Yesterday, the Minister of Education claimed he never played politics with schools, and today the Minister of Health says he's never played politics with health. The Ethics Commissioner says that the Education Minister did play politics with schools. Now, we see the government making health care promises to areas where it needs to curry favours. Meanwhile, mold at the foothills is ignored, the Misericordia is falling apart, and sewage issues in Wainwright threaten the entire facility. Minister, are you really going to stand here and tell...
Honourable Minister.
Mr. Speaker, this government's investing over $200 million for a 3-year period to invest in rehabilitation hospitals. Yes, I say there are issues we need to fix, but we are fixing them. We're working hard across the province to invest in the future Albertans in our health care system.
Second main set of questions, Honourable.